Welcome back. Orange Park Medical Center has just recently opened a rehabilitation center for its patients. Both Dr. Kalman, who is the medical director there, along with Kristen Gurking, who is the program director, has a lot to talk about today. So welcome to you both. We're interested about this because tell us what makes this unique. We'll start with you.
Well, it's the only inpatient rehabilitation center in Clay County. And so I think that is a huge asset for the members of Clay County, the community of Clay County. And it's a new facility with 20 private patient rooms, and it's absolutely amazing.
That's excellent. When you talk about private rooms, a lot of people don't like to share rooms, so everyone has their each and own room as they continue to get better in your rehab facility. What sets your facility apart, Doctor?
Well, a few things. One, as she's mentioned, it's brand new, it's gorgeous. They're spacious rooms, and it's a nice atmosphere to do your rehabilitation. The other thing is we're one of the few rehabilitation programs in the country where you're doing therapy at least 7 days a week. Sometimes places take a break on the weekends. We are staffed, and we don't take a break. We do therapy 7 days a week at our program.
Now, there's a big misconception I know out there pretty much universally about the difference between a rehab facility and a nursing home. And much of it has to do with the quality of care. Could you explain the difference to the viewers at home?
Sure, absolutely. In an acute inpatient rehab facility, the patient is going to get 24-hour rehab nursing care, plus there will be a physician there every day on call 24 hours. So in a skilled nursing facility, a physician may round only once a month. So that's what separates us from a skilled nursing facility.
What I like about it seems like he's saying, it's pretty much around the clock. If somebody needs help, they don't have to wait.
It's right on the hospital campus. So all of the acute care hospital services available to the patients in the hospital are also available to the patients in the inpatient rehabilitation facility.
So this is just a temporary facility for people to get better. After they, I guess, are cleared, after they get to a certain point where they can function on their own, then what happens? Do they go home or maybe into a nursing facility at that time, or how does it work?
Yes, our goal is to try to get everyone to go home. They go for therapy, and that's our hope, is that they go home. But in some cases, they can't, and then they may go to another nursing facility. But in the meantime, while they're at our facility, we're training the families also. So they make that transition to home a lot easier.
Right. We actually have it's called the Activity of Daily Living Suite. It's set up like a home apartment. And there's a regular bed, there's a regular kitchen in there where the patients can practice the things that they would need to do when they go home in a real controlled setting with the assist of a therapist and or physician.
Now, is that one of the rooms we're looking at right now of the case in point?
That's one of the patient rooms, the private rooms, and they all have those beautiful big windows and state-of-the-art finishes.
And that, of course, looks like the nursing station right there on the floor. So everybody, how many rooms do you have in there? Everybody can easily get a nurse if they needed one.
Absolutely. We have 20 rooms.
20 rooms. Okay. And, you know, would you say, what would be the normal stay for something like this? And I know it would depend whether someone's coming in for maybe rehab for a stroke or an amputation or something like that. But just in general, what is the average time of stay for these?
The average length of stay is about 14 days or 2 weeks, but it's definitely dependent on the diagnosis and, you know, all other variables about the patient, their age, other comorbidities or health conditions they have going on are all factors in how long the recovery lasts.
What I think is great, too, is because the Orange Park Rehabilitation Center is then connected to the Orange Park Medical Center. So I'm guessing you see a lot of these patients, if not all of them, are coming from the medical center, or do some come from other facilities?
It just depends. They can come from both. A lot of them do come from our medical center, and we haven't been open long enough. As like you said, it's brand new.
It's brand new.
So we, you know, but there is the availability that they can come from the community. And the fact that we're right near the acute hospital is another great aspect of our facility, is because the physicians actually are excited about it, because there's continuum of care. They can come right over and see the patient when they're transferred over to our facility, rather than lose them in a shuffle when they go somewhere else.
Now, who qualifies as a patient to become a person that will go into the rehab facility?
Well, I guess if somebody thinks that they might qualify to be a patient in the facility, they should definitely discuss with their physician. And then if they're, they come to a conclusion they might be a good candidate, they can call the referral line. And then at that point, they talk to an admissions director to determine if they would be a good patient for the facility.
I think this sounds like a great opportunity, at least for you guys. It sounds like there was definitely a need for it, right?
Absolutely, absolutely.
Yeah, because before this, I guess they had to go out and in different places. And the nice thing is the doctors are all so close, so they can just pop in and check in on their patients.
Yes.
So what do you foresee for the next year to come?
Well, I think a lot of rehabilitation will take place, and a lot of patients will be on the road to recovery in an amazing facility with amazing providers and therapists.
Okay. Very good. Any final thoughts?
No. We're just excited to have it, and I think that patients and families will be very happy.
Okay. I think it's always good, as a family member of someone who has had to have a loved one in some kind of a facility, you really want to make sure that that facility is staffed properly and has state-of-the-art equipment, which yours does, which always gives, I know, family members some peace of mind, for sure and certain. Well, thank you both for coming in, and we'll look forward to having you guys again next month in some capacity.
Thank you.
Thank you.